One thing that we frequently get asked when we're going to do any treatment, but composite bonding especially, is how long is this going to take? Truth is, there is no one size fits all. You know, some cases might be very quick, it might be very, very minimal. Some cases ultimately take a bit longer. I'll show you one case. I can show you the before, I can tell you what we did, I'll show you the afters, and I'll tell you how long this case took. This is quite an extensive case. Not all cases take this long. It's about the maximum. So I do not like to treat patients for too long. Ultimately, there is a patient connected to the teeth, and we've got to think about your comfort as well. We obviously have the comfort menu. We can give you the VR glasses. We can give you a little prop to hold your mouth open. This all helps to make it a bit more comfortable, but we do like to keep appointments as short as we reasonably can. So this gentleman came to me with concerns about his teeth. You can see a few issues here. His issues, from his point of view, was the colour of his teeth. He felt they were a bit too yellow, and also he had quite a bit of wear pattern. So he had 3, 2, 1, 1, 2, 3, a little bit of an imbalance in the level, clear enamel edges, and a bit of wear. So what did we do? We kept things minimally invasive, as we always do. The most precious dental material is your natural teeth. One approach would have been simply to do crowns or veneers, but this would have involved losing an awful lot of natural tooth substance. The remit was that he wanted a natural look. He didn't want to look, like his teeth were fake. So what did we do? We did some whitening initially. We kept the shade fairly natural. We took him up to shade A1. And we did some composite bonding. So we bonded 3, 2, 1, 1, 2, 3 with minimal edge bonding. So again, this is the same gentleman in side view. You can see his teeth are a natural colour. They've gone to A1, and we've performed composite bonding. You can only see 3, 2, 1 and upper left 1 in this case, but these were all bonded, minimally invasive, maintaining as much natural tooth structure as we possibly could. So this appointment was in total, so before we had the whitening visits, which in total took just short of an hour between scans, fit, review. There was a bit of treatment planning behind the scenes on my part, but the actual treatment, the actual composite bonding took 2.5 hours, and after these photographs were taken, there was another 40-minute appointment, which was just for refinement, for final polishing. But patient was happy. It's a nice, natural result. This is another case. Now, this lady came to me with crowding. She was unhappy with the colour of her teeth and the crowding on her teeth. She underwent orthodontic treatment using Invisalign, but it was always going to be an ortho-restorative case. By that I mean that we would straighten the teeth, would get them into a suitable position, allowing us to then restore the teeth and create a beautiful final result. This is post-straightening. So we've straightened everything, we've created ample space for the restorations, meaning that the restorations will be durable, they will last, they will look natural. Simply restoring this lady's teeth would not have worked. The issues with her bite would have meant that she would have knocked these restorations off very quickly. Again, 2 approaches potentially doable for this case. First one would be simply a restorative approach, but that would have required crown work. It would have required an awful lot of prepping of the teeth. So this is after the straightening. Still issues, as you can see. We can see the historic wear, slight unlevel, of the lower incisors. Again, historic wear that's causing that. But this is us after round 1, if you like, of treatment, which was the orthodontic treatment. Now, orthodontics, I always call it slow dentistry. It took 12 months to straighten her teeth. Total appointment time for the straightening was 4 hours and 40 minutes. This then moved us on to whitening her teeth, and then finally allowed us to then restore the teeth. And this is following the restoration.
So again, the lady wanted a natural result. Excuse the abrasion powder that's visible on her lip, but this is us on the day of the bonding completion, still to come back for final refinement and polishing. This took 2.5 hours also, which is quite a long time, but well worth it. It's allowed us to preserve as much natural tooth substance as possible. She then returned for 30 minutes afterwards, where we did final polishing, little tweaks to shapes, just to get emergence profiles and embrasures. But again, you can see nice natural result, maintaining as much natural tooth as possible, future-proofing it by aligning her teeth prior to the restoration, meaning that these restorations will be durable and will last a long time. This lady came to us happy with her tooth colour, but her complaints were the shape of the central incisors, the space between the central incisors, the slight spacing and the shape of the lateral incisors. Now, as I said, it's not a one size fits all. What appointment time works for one person doesn't work for another. So we didn't do any whitening in this case, we just went straight to restoration. Again, composite bonding only. Again, you could have treated this with veneers. If we can, we like to do composite bonding, and that's exactly what we did in this case. And here we are, the final result on the day of treatment, still to come back for final polishing. We have done minimal edge bonding to the lateral, the central and the lateral, so 4 teeth in total. We've closed that midline gap, and again, all achieved with composite. Minimal preparation to the teeth, very minimal, maintaining as much natural tooth substance as we can, because again, that is the most precious dental material. This took 2 hours to do. She came back for a 30-minute refinement appointment where angles were improved and final polishing was performed. And again, a nice natural look, maintaining as much natural tooth as we possibly could. So I hope you can see from those few cases that I've shown you there that appointment times do vary from patient to patient. Sometimes very minimal cases, we may only take a 1 hour appointment to do. If there was an average, I would say probably about 2 hours, which sounds a long time, but I class it in the category of quick dentistry. It's not like Invisalign where you get sick of the sight of me because you're coming in, every 6 to 8 weeks over the course of maybe 12 months. This is quick dentistry in the sense that we see you, we plan the case, and then we do the case and you leave with the result. So if I was to pick an average, I would say 2 hours, but like I say, some cases we might do them as quickly as an hour, even 40 minutes if it's very minimal. More extensive cases, it might take 2.5 hours in total.